Hi everyone, welcome back to my channel. My name is Dr. Sarah and I am a naturopathic doctor specializing in dermatology. Today we are talking about seborrheic dermatitis, what causes it and how to treat it naturally. I made a video a few weeks ago about a natural shampoo that really helped me get rid of my seborrheic dermatitis, but this was a product I added to my treatment protocol after I made diet and lifestyle changes to address the root cause of my seborrheic dermatitis. So that's what I want to share with you today, taking a deeper dive into what causes seborrheic dermatitis and how to treat it naturally. For most people, you can't just add a natural product and expect that to fix all your problems when the rest of your life is unhealthy. But when you live a healthy and balanced lifestyle and start to see some improvements of your skin and your scalp, this is when I like to add in a natural product, and this is also when I see it working the best. What is seborrheic dermatitis? Seborrheic dermatitis is a papular squamous disorder patterned on the sebum-rich areas of the scalp, face, and trunk. So this presents as thick, scaly flakes and plaques on the skin and the scalp. The skin can be itchy and greasy and scaly and inflamed. One thing to note before we get more into the causes and treatments for seborrheic dermatitis is you want to make sure that you have the proper diagnosis. Oftentimes seborrheic dermatitis can be confused with plaque psoriasis or tinea capitis. Tinea capitis, that can be ruled out by doing a fungal culture, and then with scalp psoriasis you see more redded inflamed erythema on the skin and then the more classic white silvery plaques, whereas seborrheic dermatitis can be more yellowish and greasy. But just be sure to consult with your dermatologist for the proper diagnosis. Another interesting thing to note is that seborrheic dermatitis has a biphasic incidence, so meaning we see this occurring in infants around 2 weeks to 12 months, as well as later in life in post-adolescence and adulthood. So usually when you see dandruff in children, this is going to more be indicative of a fungal infection such as tinea capitis. And I just thought this is interesting and something to keep in mind. Now let's talk more about the causes of seborrheic dermatitis. In addition to sebum production, seborrheic dermatitis has been linked to malassezia, immunological abnormalities, and activation of the complement system. Malassezia is a genus of function that is part of your normal flora. And with seborrheic dermatitis, we oftentimes will see high to normal levels of malassezia. But really more so with this malassezia that we're seeing in seborrheic dermatitis patients is that they have an abnormal immune reaction to this fungus, which is not so fun. Specifically, this is linked to a T-cell depression, which is important for your immune system, and activation of the alternative complement pathway, which is part of your normal immune system response that your body utilizes to kill pathogens. Now, the problem here is that this malassezia is part of your normal flora. So why is your immune system activating this response? In essence, it's an overactivation, oversensitivity of your immune system that's causing inflammation, irritation, and essentially a lot of the symptoms of seborrheic dermatitis. Overall, the exact pathophysiology of seborrheic dermatitis remains a little unclear, but malassezia organisms themselves are probably not the cause of seborrheic dermatitis, but are more a cofactor that's linked to that T-cell depression, the abnormal immune response, and activation of the complement system and overproduction of sebum. People prone to seborrheic dermatitis may also have a skin barrier dysfunction, so of course we see this in atopic dermatitis, and so really seborrheic dermatitis is more of a multifactorial disease. It's not just limited to your scalp. It really also is impacted by your skin flora as well as your gut microbiome. So we're going to take a look at what could be going on with your gut and the microbiome. So what actually causes cradle cap in infants or seborrheic dermatitis in adults? Now when you look online, you'll see stuff about the overproduction of sebum, the impact of malassezia, and then even the abnormal immune system response that's happening. But I like to take a look further than that. Think about what's causing this sebum to be overproduced and what's causing this abnormal immune reaction to the malassezia. So we have to address the root cause. And oftentimes here, really the root cause is going to be related to that inflammation, the immune system function, hormones, and then you have to address diet and stress. A little note about hormones is that studies have shown that men with higher amounts of testosterone are more likely to have seborrheic dermatitis. And then with women who have higher levels of estrogen, this can lead to more seborrheic dermatitis. So we definitely see that in pregnancy when you're having a surge of estrogen as well as progesterone, that there can be a recurrence of seborrheic dermatitis or worsening of your symptoms. There's definitely hormones playing a piece too with infants in cradle cap, because all of those hormone changes that are happening postpartum is affecting your body and your breast milk if you're breastfeeding your baby, and that could be impacting the scalp health of your infant. So definitely something to keep in mind, and that could be potential cause here of seborrheic dermatitis is if you have this hormonal imbalance. All right, the next thing we're going to take a look at is gut health and how gut health impacts your skin health and therefore seborrheic dermatitis. So the microbiome of the gut impacts the microbiome of your skin, and this is also related to the gut-skin axis. The microbiome is the key regulator of the immune system, of which about 80% is found in your gut and in your digestive tract. It aims to maintain homeostasis by communicating with your tissues and your organs in a bidirectional manner. Therefore, dysbiosis in the gut microbiome and essentially the skin microbiome is associated with skin conditions such as seborrheic dermatitis, and then we also see it in atopic dermatitis, acne, psoriasis, and even skin cancer. And then related to this is food allergies and food sensitivities. So these also have a big impact on your gut health, because your gut health is activating that immune system response to these food allergens, and so that leads to inflammation and potentially a leaky gut, which can lead to leaky skin. So for some people, they have been sensitive to different foods, and that could be contributing to your seborrheic dermatitis. All right, now on the topic of food, let's talk about diet. So basically, seborrheic dermatitis is primarily an inflammatory skin disease. And so one of the biggest contributors to inflammation in your body is from the foods that you eat. So there's a lot of obviously inflammatory foods out there, sugar being the main culprit, really. Sugar has been shown to increase inflammation in the body and have negative impacts on your skin health. And so I definitely see that with my seborrheic dermatitis patients. And then the other two common big inflammatory triggers are going to be gluten and dairy, especially if they're just conventional. They're not a problem for everyone. So if you are going to consume gluten and dairy, try to always do organic and raw, natural form of these products, unprocessed. And then the other important thing to keep in mind with diet is that you can add probiotic rich foods, which are going to help your gut microbiome and then help the skin microbiome. So these are going to be fermented foods such as sauerkraut and kimchi, low sugar probiotic rich yogurts, kefir, beet kvass, kombucha. Those are the main things with diet. Try to either reduce or completely eliminate all processed sugar. That one is huge, and it's very hard to do, but it makes a big impact on your skin health. And then if you are sensitive to gluten and dairy, that would be another consideration to try doing an elimination diet. That's really the truest test, is to eliminate a food for 30 days, and then after that 30-day period, you reintroduce it and see how your symptoms either worsen or don't change at all. And that's going to be the true test, is doing an elimination diet for these foods. All right, now let's talk about how stress is impacting your seborrheic dermatitis. When you're really stressed out, this causes an increase in the stress hormone cortisol. And cortisol causes an increase in that oil production in your skin. So this is directly impacting your skin and your scalp, is having an increase in that cortisol being produced. Stress also causes the immune system to overreact. And maybe that's why we're seeing this abnormal immune system response towards the malassezia. It could be due to stress causing that overreaction, and as well as sending out an inflammatory response. So this is something definitely to take a look at, just to see how stressed you are. And of course, for some people, this can be in the form of a stressful or traumatic effect. And a lot of times then we see some sort of skin manifestation. Some people it's seborrheic dermatitis, some people it's eczema, some people it's acne. But then more than that, they also just your kind of daily stressors are also going to be impacting you here in your skin. Anything like when you have an argument with a friend or someone, or something causes you to be upset or to get bothered. Even when you're driving and someone cuts you off, that causes a little stress response in your body. And so one way to help deal with this is to have some form of stress management. And so this can be in the form of meditation or breathing exercises. Yoga, exercise is a great stress relief. So doing something for your stress and your mental health is going to be really important. And then the other thing I want to talk about here with stress is the idea that what you think about, you bring about. And so sometimes when you're constantly thinking about your skin and you're thinking about your skin or your scalp in a negative way, wishing constantly that it was different, or that if you think it's ugly or unattractive or just plain miserable, that can sometimes further perpetuate the problem here. So the key here is to accept the symptom as it is in the moment, and then really use that as a tool and view it as a message that your body is sending to you so that you can address it in a positive way and do something that's really going to be loving towards your body and loving towards your skin. So this can be by consuming healthier foods and doing something for you to relax, getting outside, getting some movement and exercise in, and just what are the thoughts that you're thinking about yourself and about your skin. I wanted to give a little example too about the thinking about it. So when I had seborrheic dermatitis, this was a couple years ago, I had a pretty kind of big flare-up of it with really thick plaques and like chunks of my hair were falling out with it. And I'm a type of person where I usually pick at things, and that definitely makes it worse. So there was this one time where I wanted to get hair extensions. This was like 6 or 7 years ago. And I had these hair extensions put in that my hairstylist put them in, and they weren't ones that I could remove out by myself. And during this time, I remember having seborrheic dermatitis, but I couldn't pick at it and take the chunks out. And I kind of had to just like leave it alone and accept it as it was. And during that time of having those hair extensions, I can't remember how long I had them. Maybe it was like 2 months or something. My scalp really, by the end of taking those hair extensions out, improved a lot. And I think that was like the main thing that I changed, was not picking at it and not constantly thinking about my scalp. And it just made a big difference, I think, because when you can accept it, move on, and not constantly think about it, that helps. So just try to let it go, try not to think about it, but still do your best to love your skin as it is in the moment. And it's something that you can get better at over time. All right, lastly, I just wanted to talk about some hygiene and hair care products. So you want to be washing your hair every 2 to 3 days. Every day is just going to be too much where you're stripping your hair of its natural oils and the sebum. And then internally, this causes your body to produce more oil because it's thinking that it doesn't have enough there. So that just further perpetuates the problem. So you definitely don't want to be washing your hair every day. And then when you are washing your hair, try to avoid harmful chemicals in your products that you're using. So these are going to be like parabens and sodium lauryl sulfate, as well as fragrances. And try to use natural and organic products on your scalp and your skin whenever possible. Like I said in my other video, the natural shampoo product that really worked for me was the Remedies shampoo, and I'll have a link down for that if you want to look that out. It's not sponsored or anything, but it's just a product that really worked for me and my scalp, and it was kind of like the cherry on top that I needed after I made the dietary changes, avoiding the sugar and the gluten and the dairy, managing my stress, and then I added that product, and that really helped. And then some other things that you can try is tea tree oil or oregano oil in a little bit of coconut oil or flaxseed oil. So you do 2 to 3 drops of the essential oil and about a teaspoon of the oil, and you can massage that onto your hair for a nice like weekly hair treatment. That's pretty much going to be this video. I really more wanted to stress about the importance of the foods that you're eating and how stress is impacting your seborrheic dermatitis, as well as take a little look at how hormones and your gut health are impacting your scalp. If you enjoyed this video or found something valuable and useful in it, please give it a like and consider subscribing to my channel. So it really supports my channel and makes it possible for me to continue producing videos. If you have any questions, leave a comment down below and I try to respond to all the questions and comments when I can. All right, so we'll see you in the next video. Bye-bye.